Hello, everybody. We are back here on Healthcare Experience Matters, joined today by Dr. Trevor Turner. He's a physician coach with the Healthcare Experience Foundation. We're going to be talking about patient-centered communication, empathy, and the busy practice environment, how that makes everything a little more complex when it comes to empathy and good communication. So before we jump into that discussion, Dr. Turner, just introduce yourself for our listeners and tell us a little bit about what your professional background entails and what you currently do.
Hey, Casey, thank you so much for the introduction. My name is Trevor Turner. I am the director of the Center for Orthobiologics here at Georgia Bone and Joint, which is a mid-sized ortho practice. So we've got 10 docs and 6 PAs, and then we've got a crew of fantastic staff that accompanies them and also helps run our surgery center, our 2 PT gyms, and our 2 MRIs. So we've got a lot of folks under our umbrella who help us, do what we do, and we couldn't do what we do without them. So we're grateful for that. I'm in my 8th year of practice now. So I started my career off at the Andrews Institute in Pensacola, Florida, and with Baptist Medical Group there. And then about 4 years ago, left for this directorship job here. So I hold some directorship roles, kind of some dual roles as the clinical director for our physical therapy gym, and then also as the laboratory director for the use of our platelet and bone marrow derived autografts to treat different orthopedic pathology, both in the OR and then out of it as well. So it's a fun place to work with a lot of things changing and going on all the time. We cover all of our kind of local high school sports. So we get the opportunity to see a lot of great patients from there, and then usually also their families as well. So we're thankful for the opportunity and thankful for the chance to have survived through the last couple of years when the pandemic made things a little bit challenging at times, but we've learned a lot, I think, over the last couple of years, and are fortunate to still be here and be able to provide a great care for the musculoskeletal community here in the south side of Atlanta. So,
all right. Well, tremendous background. And, I always like to find out what your kind of why is and what drives your passion for patient care and providing a great patient experience. So before we start chatting about some patient-centered communication skills, let's have you tell us a little bit about your why.
Okay, it's a long story, but thanks for the question. So I actually grew up in Dallas, Texas, and I got my medical school training there at UT Southwestern and Parkland Memorial Hospital, which was great. It was a very busy trauma bay. It was a very busy OB unit. It was a very busy ER. It was a very busy, pretty much everything there. Big medical school class, big residency program. I grew up sort of watching my dad, who practices anesthesia there, and I liked the way that he practiced. So he seemed to be really bought into the notion of the Hippocratic Oath and the fact that you practice regardless of somebody's ability to pay, and you provide compassion to people when usually they're really, really scared and threatened. So in his capacity, he does PD cardiac anesthesia. So doing anesthesia for these really small, sometimes preterm babies who have heart defects, who are getting major, heart surgery in the hospital. And obviously that is pretty stressful, but also it, goes along with having to provide a level of calm and repose for parents who are scared about their kids. So I grew up with that model, and then had the opportunity to have, fantastic mentors throughout medical school and residency. And also had an opportunity to go work overseas in a few different capacities. So I spent some time working in Juarez, Mexico, and Guatemala, Haiti, and Swaziland, which is in the southeast portion of Africa. And that was actually one of the most foundational group of experiences in terms of, how do you communicate well, especially if there's a language barrier, and, not only from do you speak through an interpreter, but how do you manage your nonverbal cues and pick those up when you're talking to somebody else, and also trying to be mindful of those things in the way that you communicate with somebody else, even if their social and cultural sort of mores are different from the ones that you grew up with. And that taught me a lot. I mean, I think I spent time while I was there sort of reading about some other models that weren't necessarily physicians, like Mother Teresa and people who are really known for incredible compassion that sort of transcends like a lot of the boundaries that we perceive of. But I think that's probably, where I got my start in trying to figure out how you are able to meet somebody on their own level. So,
and now let's shift the discussion a little bit towards the kind of the heart of what I wanted to ask you about. I appreciate all that background information that really sets the stage for us. So what does effective patient-centered communication look like to you, Dr. Turner?
Yeah, well, so that probably starts, I think Katie and the rest of Healthcare Experience Foundation would say that starts really when you walk in the room with the way you make eye contact with somebody and the way that you sit down and start to give, the immediate impression that you're dialed in to whatever that patient is really there for. And so, the interesting thing is like a substantial amount of your rapport with that patient is already set from that first, 10 seconds or so. Right. And there's other things we work on, like, coming in and showing that you're, having washed your hands when you shake the patient's hand and touch them, and, or how do you modify that in the COVID environment, et cetera. But, so I think, that's probably how it starts. And then, part of the, like the fun part is like for us, I mean, I work in an outpatient setting, so we see, a lot of patients in a day. And it's always the sort of the challenge of figuring out what the patient's actually here for, because a lot of times what's posted in our electronic medical record is not what the patient is coming in to the practice for that day. And I think some of that has changed a little bit as people are able to book online, because when they start booking online, they can write, more open-ended sort of prose about why they're really there. But so that probably is the first part. And then, the question is like, we still have certain demands on our time based on like how many patients we have to see, and when you're going to the OR and not going to the OR, rounding in the hospital, et cetera. So probably the biggest challenge is to be able to convey with someone, or to make them feel, in those moments that you spend with them, that they are absolutely the focus of your attention and the most important person in the world, for that short time that you have with them, and for that to feel genuine, so that they feel like you're connecting on the level that they are coming into the clinic with. And I think, we can do some things with systems to probably make our systems a little bit more efficient and a little better. And certainly the other team members that you have on your team and their ability to also exert compassion and their ability to make a patient feel heard and listened to makes an enormous difference, because medicine is just such a team sport. It's just not something that a high-powered individual is able to do on their own. We just don't work in a vacuum like that. But I think that probably is the big challenge of the modern healthcare environment, when, especially if you're stressed and you haven't slept very much, and maybe you've asked for some extra things and you don't always get everything that you're asking for to support you, is still being able to go in to a room and make a patient feel that way when you come in.
How important is the role of empathy when it comes to elevating the patient experience?
I'd say essential. So, a lot of times when I work in the orthopedic and musculoskeletal environment, right, which is a little bit different than, certain other specialties that are dealing constantly with life or death, or, dealing with, major ethical questions, potentially. And we've seen a lot of that certainly be a challenge in the last couple of years of the pandemic. So one of the things that a lot of patients, I think, define themselves by is their level of function and what they're able to do, and how much that actually contributes to a lot of the other comorbidities that we see in medicine. So, for example, we know that cardiac disease is like a major killer in the United States, and it's one of the leading killers of women, for example. But a lot of times the question is, well, why did you get that cardiac disease in the first place? And some of it has to do with diet, but a lot of it also has to do with your movement and immobility. So in that sense, like I see great meaning in what I'm doing because I'm focused on preventing sort of the downstream effects of what, affects a lot of the disease and mortality in the United States. But then also talking to the patient in particular about what gives them meaning. So that to me, when you're trying to be empathic and you're trying to stand in their shoes, if you would, becomes like the critical question, right? Because for some patients, that meaning is I have to pick up my grandkids, or I'm a single mom and I have a couple kids, or I'm the provider for my family and I can't miss work. But then sometimes it's, I've got to squat clean 350 to be able to go to the CrossFit games. And that's fine if that's what gives you your meaning. In fact, I think it's great and it's cool. And we love working not only with, younger athletes, but also now what we'd call the masters athlete, which are, usually people who are 40 plus that are still interested in being active. And that's such an important part of the rest of their health, but understanding what it is that gives them that meaning. And it's when that particular function is affected or lost or impaired for some period of time after they get hurt or sick or injured, is oftentimes what drives the connection between the meaning for me of what I do and then the meaning for them of ultimately what is it that they're seeking to achieve when they come in the clinic. Because, most people would say, well, I'm hurting, I don't want to hurt anymore. And you're like, okay, well, I know that, but like, why do what is it that your hurt keeps you from being able to be that? It's the fullest expression of like who you are as a human being. Right. And the second that you get to that point and hearing that point come out of the patient's mouth, really galvanizes that, that empathic connection between the healer sort of in that clinical moment with somebody. So.
And I look at what you do and in your specialty as a fast-paced environment, very busy. You see a lot of patients every day. So how easy is it to overlook things like empathy and compassion in that environment? And do you have any advice for dealing, kind of keeping grounded in that fast-paced environment?
Yeah, super easy. So I would say, I've heard it said before that, and I don't want to make light of the fact that it's hard to study really hard and take your MCAT and go to medical school, because that is really hard, and to go to residency, and there are certainly people who probably would be great physicians and PAs and nurses and everywhere else down the chain who don't get the opportunity to practice because that's hard. But there's sort of a joke that it's kind of like, okay, well, if you're able to graduate, like if you're able to graduate medical school and you're able to go to residency, then it's like easy at that point to be like an average doctor, or an average at whatever you are. And no way to belittle the process it takes to get there. But that really that top percentage of people, who are practicing at the highest level, it requires an extraordinary amount of discretionary effort, right? And so we've got, people who work in the management, I think, field and are PhDs, and they're publishing on great businesses and how do you run those. They I think they refer to that as engagement or employee engagement. That's certainly like a big, buzzword in the hospital space, and probably just in the business world in general. But so I think that discretionary effort is the thing that produces the sort of the world class or the expert or the person who really makes the kind of connection that have people say, by the time you finish your encounter, whether it's long or short, when they have that kind of that light bulb go on, or that statement where they say, this is the first time anybody has ever actually explained what's going on to me, or this is the first time I've ever actually had an understanding of what it is that I've got to do, to get better. So then it, like when you have that sort of light bulb moment, you've achieved like step number one. And then, step two is obviously following through on the restoration of that function or that expectation that you set, as a goal in that first, encounter. And I think if you reach that point, there's a pretty good chance, like when the patient is bought in, that if you know what you're doing and you've been, trained pretty well, that you're going to achieve those goals as long as the rest of your team understands that message and follows through on it the same way. And so, that can sometimes be, depending on how many patients you're expected to see a day. I mean, that can be hard. But I think when your day is full of patients who are saying that, it makes it fun to go to work again, which is very different than practices. If you don't have those moments, you don't have those opportunities, it's hard to feel like that or to be really excited. And so I think as we look around the country and we look at, burnout, not just in the physician industry, but also, nursing and a lot of other allied health profession fields, one of the things that we've got to figure out is what can we do to make the system better, to enable or to create those moments between whoever your healthcare provider is and that patient. Because when we do that, it feels good to do your job well, and it feels good to make it about something more than just the job where you're going to do what you've been trained to do and get paid for it. And it's about, what it means to live, I think, in a community as human beings together. So,
Dr. Turner, did you have any mentors that helped you with things like patient-centered communication and maintaining empathy? And if you did, what did you learn from these mentors? And then what kind of advice do you have for young healthcare providers in establishing some mentors to help them with things like this?
Sure. So yeah, certainly my dad, being one mentor. Another is when I was still in medical school, we got assigned a mentor for like a small group of medical students together. So her name was Mary Jane Pearson, and she was actually an OB-GYN, which was not the field that I was going into, but she dealt with a lot of people who were scared, because they were scared they were pregnant, or did they have a disease, or were they not going to be able to get pregnant, or were they going to have a health complication that was going to be super serious if they did get pregnant. That means they were going to need, advanced ICU care. And so she was such a super calm, non-threatening sort of presence. And to see that play out in front of people instead of I think there's a certain image of like, I'm the old school, physician, and I'm paternalistic and I'm telling you the way it is. Right. And she was just not like that at all. She was very much an example of like, hey, like I'm your partner, on this journey, and we're going to get through this, together, and you're going to be okay. Right. So that was probably one of the best early examples I'd seen. And then, everybody I had a chance to work with in Africa who was working with Doctors Without Borders was such a great example, and the Baylor International Pediatric AIDS Initiative, and just the steadfastness with which it took to keep doing work like that, despite the sort of the overwhelming odds of poverty and social cultural transformation that had to go on to make that sustainable. And then, ultimately in my last practice, James Andrews, who is kind of, people joke that I guess he's on, if there was like a Mount Rushmore of orthopedics in the United States, like he'd be on it, but it was interesting because I tried to ask him one time about what was the moment in his career that sort of like propelled him to this level of stardom, because he's got, laundry list of all these fantastic athletes he treated, and Drew Brees came back and won the Super Bowl, and pitchers and so on and so on. But he just kind of said to me, he was like, it's not a singular moment. He's just like, you just get up every day and just decide to do the right thing. And I saw him giving his cell phone. He was always giving a cell phone number out to patients. He was definitely like, not wanting to provide these barriers like between like EMRs and systems and a lot of things that I think make make medicine feel somewhat impersonalized, like now in the United States. And so seeing that amount of service and that personal attention to detail was an example that, showed me if you really want to, if you really want to build something big and bold and beautiful, that makes people feel valued, different from what can sometimes be a fairly fractured or poor customer service experience, I think, in medicine compared to like some of the other industries that we have in the United States. That was a fantastic example.
Wow. For your field, I mean, that mentor, I mean, to have your dad and then Dr. James Andrews, I mean, that is incredible. So yeah, I mean, Dr. James Andrews, as a sports fan, you hear his name come up every year with something. And yeah, that's just really, as a sports fan, I have to throw that in there. That's really cool. Is Dr. James Andrews, is he the one that developed the Tommy John surgery, or is that someone?
Yeah, he's known for that among some other things, but yeah.
Incredible. So let's flash back to when you were a young healthcare provider right out of residency. What kind of advice would you give yourself, knowing what you know now, on patient-centered communication, maintaining empathy, or really anything?
Yeah, gosh, that first year out of residency is so challenging because what you've realized is, and I guess it depends on the environment in which you practice, whether you go into academic medicine or private practice or not. And for me, I was employed by a healthcare entity or a hospital, I guess, association, but I was still, in private practice and expected to produce at a certain level of financial accountability. Right. And you don't get trained to do that so much in residency. I mean, you figure out in residency how hospitals work and how to get things done and how to work as a team, probably much more so than medical school, which was more, how do you achieve highly as an individual? And I think in residency, you see team players really rise, they rise to the top. But I think, it's easy, I think, as a right out of residency to get a little bit overwhelmed. And sometimes people have put on hold certain things like getting married or buying a house or just things that maybe a lot of our peers had done at a younger age who didn't have the same training pipeline in terms of, time maybe as we did. But I had an advantage because I was by the beach, so I could just I could just go to the beach for a day and reflect a little bit on that. But I think making time for reflection and then just not losing sight of your mission, and I think there was a study that was done at Yale, and one of our our team members, Kathleen, likes to talk about it, about all of the people that went to Yale, and there was a group of people that had physically written goals, like on a piece of paper. And then there was everybody else. And so they went back and looked like 10 years later at the graduates of obviously who were all, a group of amazingly talented people. And the group that had actually physically written their goals down were the ones that had achieved them. And the ones that did not actually have written goals out, most of the time did not, in terms of what they were able to do and grow and produce and how much they were able to grow almost exponentially into their potential. And that may not have been something that people needed to do when it came to just having always a path forward of, oh, okay, well, there's like another test and I study for this and I pass this. And then, oh, okay, like I get into residency and then I pass my USMLE and then like I get my first job. But now is the first time that you're like, okay, the next, 30 plus years of my life are no longer sort of just written out as a step-by-step pathway. And it's up for me to figure out like how far do I want to go and where do I want to take this, and never losing sight of the ultimate reason that you started that journey in the first place. So I would say, write those things out and don't be afraid to dream big, and then make time for reflection about why you got there in the first place.
Great stuff, Dr. Turner. Today, we've been talking to Dr. Trevor Turner, physician coach with the Healthcare Experience Foundation. Any other final thoughts or anything valuable you'd like to tell the audience before we wrap it up here?
Yes, I want to congratulate Casey Callanan on his beautiful new baby and his wonderful wife who is able to provide a great family for you guys and for you guys to make it through the joys and the ups and downs of being a family and being parents. That's awesome.
Oh, I appreciate that, Dr. Turner. Very unnecessary, but I would like to give my wife a shout out. She's unbelievable, and I'm a lucky individual. So, folks, thank you for listening to today's episode of the Healthcare Experience Matters podcast. This has been Dr. Trevor Turner. Unbelievable stuff. And I can't wait to have him come back and join us again. Take care, everyone. And thanks again for your time today, Dr. Turner.
Thanks so much for having me, Casey.